Well, a new national code of conduct means mental safety in the workplace is just as important as physical safety, putting the onus on employers to protect workers' mental health. But the question is, will it work, and what more can be done in the workplace? Graeme Cowan is a mental health and resilience expert, co-founder of We Care 365 and founding board director of Are You OK? He joins me now live. Graeme, good to see you. Thank you so much for joining us this afternoon. Firstly, set the tone for us. How do you know if your workplace is not mentally safe? What are the warning signs?
Well, I think it's just a vibe, really, Danica. You know, you don't feel people can be really dismissive. You can have toxic bosses. Your workmates don't support you. You're not working as a team. And you can actually, if you walk into most workplaces, you do get a bit of a sense of how it's going. So it is that sort of intuition, but it's also backed up. You'll find that those sorts of workplaces also have high levels of turnover. They have high levels of stress and absenteeism. And that's how you really know.
Yeah, it is a vibe. I think that's a really good way to put it. So we now have the onus on business and employers to actually measure these risks. Can you explain this code of conduct to us?
Yeah, well, basically they say that every company has an obligation to have a psychologically safe and healthy workplace. And psychological safety is where you feel you can be your authentic self. You feel that you can take risks and try new things and know that if it doesn't work out, you don't get crucified. Everyone says, well, let's learn from this and move forward. So it's really feeling connected with those around us. It's having a sense of belonging. And, particularly during this COVID period, where people have worked in hybrid ways, that sense of belonging has really broken down a lot. Now, it's starting to come back now in terms of people coming into the office, but still a huge amount are going to be working remotely and in a hybrid manner. And so being able to monitor the health and know how things are going, mental health, mood is paramount for teams, but also organisations.
So in terms of this sense of belonging and a good mental workplace, how do you implement this?
Well, for managers, they play a really lead role. You know, the best way to boost employee mental health is to give them good managers. And funnily enough, I shared that statement on LinkedIn about a month ago, and it went viral. There was like 2.7 million people commented or liked and what have you. And many of them shared anecdotes saying that they really experienced that. Now, mental health in the workplace is also, it is a complex thing. You know, we have to take responsibility for our own self-care, but all the research shows that if we have the right leadership in place and the right systems in place, that delivers the best results. And so managers should be asking themselves three questions. They should be asking themselves, do we feel connected? And the outcome we want from that is everyone feeling that we belong, we're part of this team. The second question is, do we feel safe, psychological safe? And we want the outcome of that to be, we have each other's back. And then finally, do we share a future? Do people feel involved in decision making? And are they helping to evolve the direction of the team or the division or the organisation? It doesn't mean it's a democracy, but it does mean that people feel heard and part of deciding the future of their workplace and team.
Yeah, just going back there on your point about leadership and how important that is to creating a good environment. What's the measure of success then? How can an employer measure to make sure that they are indeed implementing these risks correctly into the workplace?
Well, there are new assessments which allow you to measure that. So just like there's been engagement surveys, just like there's physical harm surveys and assessments, there are surveys that ask people anonymously to rate how they feel across a whole lot of measures. So that could include my workload. I could have too much or too little work. Do I feel in control of the work? Do I help decide how it's approached and attacked? Do I feel good support with those around me? Do I feel that I'm learning and evolving in my career? So the surveys get to the bottom of that. And ideally, all teams would want to then identify what's an area that we need to improve on. And, as I said before, having a psychologically safe environment allows us to have robust discussions. So if someone's letting the team down, you can have a robust discussion, but also a respectful discussion about what happened, what was the real cause behind it. And that's what we're looking for, is looking at the root causes of these dysfunctional teams and organisations. And there's great payoffs for organisations. If an employee is in a positive mood, they've been shown to be 31% more productive, 33% more influential, and 300% more creative. These are all very essential in this new world of work.
Absolutely. Yep, certainly not surprising when it's a good environment, that's for sure. Just finally, Graeme, have you got any tips for businesses, for business owners, about how they can start implementing these practices?
Well, one of the things that came out of our survey of 461 people is that the best way you can do that is train managers on what to do, because most people want to lead a good team, but they may not know how. And so we at We Care 365, we created simple, scalable programs that allow managers to learn how to build and lead mentally healthy teams.
Yes, some really good advice. Graeme, Cowan, we have to leave it there. Thank you very much for joining us.
My pleasure, Monica.
And if you or anyone you know is feeling distressed, you can call Lifeline on 13 11 14.